is Matt Kothe. I'm the manager of corporate communications for PerfectServe. So with me today is Dr. Rodrigo Martínez, a practicing otolaryngologist who has more than 13 years of experience as a healthcare consultant. As luck would have it, he also happens to be PerfectServe's chief medical officer. So today I'm going to try to tap all of Rodrigo's combined experience for a quick and free-flowing discussion about some of the broader trends, developments, and priorities we're anticipating in the healthcare industry in 2022. So some of these themes, of course, have actually been developing for years, so they're not brand new, but for a variety of reasons, whether it be new technology, market forces, the pandemic, changing patient behaviors and expectations, and more, we do expect that they'll garner a lot of attention in the coming year. So as a company in the provider scheduling and clinical communications space, PerfectServe does directly and indirectly touch many, but not necessarily all of these themes. So today we just want to share some knowledge and think about where 2022 might take us. So again, with many thanks to Rodrigo for joining me, I'd like to start with a theme that has been on just about everybody's mind since the onset of the COVID pandemic, which is the need for digital management. So Rodrigo, I'll pass it over to you.
Thanks very much, Matt, and really happy to join you today for this conversation. So I guess first off, I'll maybe define what I mean when I say digital management. And it's mostly around or as a result of the fact that there are more and more tools that are giving different individuals the opportunity to send messages to clinicians, and whether it's other clinicians or patients or family members, if there isn't a good set of kind of a good control, so to speak, you can potentially overwhelm your clinicians with additional work that you may not realize. In this day and age, there are many tools that already exist inside electronic health records. There are tools available that can be third-party messaging capabilities, but we're also seeing a lot of the software that is now either available to consumers or other parties, especially as we move more and more into remote care or virtual care, more and more of these technologies that are going to be feeding in potential information. And they could set up disappointment for a patient if they think that they are logging into a portal and sending a message, assuming that somebody's on the other end receiving it. If that doesn't get read, in the best of cases, it's annoying, and it may dissuade somebody from trying to engage again with that clinic or that individual. In the worst of cases, if there are important clinical bits of information, that have consequences that someone assumes someone is reading and they're not acted upon, you can imagine that that could create a lot of problems. So I think that when an organization is setting up these different bits of technology, these different systems, it's important to stop and ask the question, is somebody sending a message to somebody else? And if so, who is it going to? Who is it coming from? And does it have to be turned on? And is the current recipient the appropriate recipient? I think that over the last 10 years, more and more people have learned and understood how to work with the technology. And I think just some basic workflow hygiene, we'll call it, right, could benefit a lot of people. And I think the result will be more consistently satisfied patients, as well as less burdened physicians.
Yeah, and I think the example you gave about communication maybe being missed or someone assuming that something has been read. We had a colleague here at PerfectServe who used to share a story about patient miscommunication that resulted in a patient having to have his leg amputated. And so
Oh,
there are very real examples of how everybody has good intentions, but when it comes to management of digital communication, sometimes there are literally lives on the line. So I
yeah.
think it's a great first topic to touch on here. I am going to pivot slightly to a different topic for you here, and that's the need to adapt to competitors, especially in the primary care setting. So what are your thoughts about that?
Yeah, absolutely. So I'll begin with just, the reminder that as we as a nation of consumers have been exposed more and more to the offerings that are available to us in other industries as consumers, particularly in the ability to use online tools for self-service. So if you imagine once upon a time, you had to call in or look up in a catalog and then phone and speak to somebody to order something. Well, all of that can be done online. We've grown used to using our cell phones to change flight reservations and book new flights on the fly. We can order food and have delivery via our phones. So we've all come to expect that capability. And so with the quote unquote rise of the patient as consumer, those are forces that are impacting healthcare. And one of the areas where we're seeing that a lot is in primary care. So once upon a time, we all went to a primary care physician and they had a referral network, which was based on their friendships and so on and so on. But now more and more, the ability to offer a patient a more convenient experience is winning out. And you are thus seeing companies that have well-established practices and abilities to deliver a great consumer experience moving into the healthcare, particularly the primary care arena. So you have Aetna and CVS, that partnership, which brought to us the ability to have clinics on site at a pharmacy. And now, they've recently announced the ability to offer physicians and other prescribers who can offer more complete primary care services. So again, by taking advantage of their ability to schedule online, the ability to have a lot of transparency into the interaction, allow for a lot of pre-visit preparation and exchange of information, in addition to having your pharmacy right there on site as soon as you're done with the visit. That whole package of the experience is very, very challenging for traditional healthcare organizations to compete with. We've seen Walgreens also making similar investments. Those are two examples of kind of retail medicine clients. And then you have other groups, let's say like One Medical, that have really focused specifically on primary care visits and really focusing on the experience, leveraging technology, et cetera, et cetera. So with that in mind, what we're seeing is that health systems are being forced to adopt a lot of these capabilities, many of them hiring experts from other industries that have historically had a lot of success in consumer engagement, and learning from them how they apply both practices as well as technologies in this space. So I think overall it is an important push, one that we can't ignore. And so there are a lot of health systems and health practices that are rising to the challenge, incorporating a lot of these practices from consumer focused organizations. And I expect that that's going to bring some very positive changes to healthcare in general.
Yeah, and I think that's kind of an age-old story, regardless of industry, where when you have increased competition, people are trying to, innovate and keep up. So I'm hoping you're right that we'll see a lot of positive changes in this regard. Next trend that I wanted to talk to you a little bit about is definitely not a new one, but it kind of goes along with what we touched on with digital management. And there's just so many technology systems operating in any given healthcare organization. It's the need for interoperability. So what are your thoughts about that?
Yeah, so I mean, since the big electronic health record push, this has been a huge area of opportunity, we'll say. You have historically a lot of companies who don't necessarily have it in their best interest to easily exchange critical information with competitors. And so that has really been a challenge for health systems, for physicians, nurses, and other clinicians trying to use the system, as well as patients who often still have to carry the burden of transporting their medical records in one format or another as they move from place to place. I think we see an element of this potentially in digital healthcare communications, and we see it even in the non-clinical setting. I mean, if you think about the fact that on your phone you can probably send an SMS message using multiple different tools. But the problem is you typically can't send a message between tools. And so, very often the standards have not been established, and there isn't any reason, any good business reason that has been identified for many of these companies to compel them to change that. So I think we continue to be in a bit of an area of limbo when it comes to connecting these disparate tools, but certainly progress has been made, whether it's partnerships that have been initiated by some of the major EHR vendors, technologies that can function as intermediaries, almost as towers of Babel or adapters between different technologies. But that is still, a ways off. I think most people who enter the process either as, clinicians or as patients, wish there could be, one single app, to rule them all, one type of universal translator that would allow for people to just be exposed to a single user interface or a single synthesizer of all of these messages. But it doesn't exist quite yet, and certainly not in a way that is robust enough to handle the complexities of modern healthcare and all of the different types of data that need to be passed along in that modality. So definitely, it's still the holy grail, I think, for healthcare. Yeah.
Yeah. So work in progress, excuse me, kind of like it has been.
Yeah. And definitely one where we're seeing progress. So
good. Okay. This next one is near and dear to our hearts at PerfectServe. So I'll call it the need to address burnout, but I've also noticed a shift in focus to calling this provider or clinician wellness, which I like. And obviously for us at PerfectServe, much of what our technology does is reducing some of the administrative and logistical burdens and roadblocks that people face every day. So we've kind of been operating in this space for a long time, but I also realize that when you talk about burnout, there's no silver bullet for it. So just kind of tell us what you're thinking about burnout and kind of how people will be thinking in the coming year.
Yeah, no, absolutely. I think that the main influencers of burnout, I'll say pre-pandemic, are different than the ones that we think about now.
Right.
It's, again, yet another component of our lives, and particularly in medicine, where we're going to be able to define a clear point in time where things changed abruptly. And in this case, being pre-pandemic versus post-pandemic. And so I think that what we have found as a result of the pandemic and the influences of burnout have not only been how overwhelming the number of sick people have been, and I would say probably very early on, clinicians and providers really rose to the challenge, and perhaps were kind of in a frame of mind of, okay, this is what I've trained for all of my life. But
Right.
when you sustain an emergency state, it tires and impacts us as humans in a very, very profound way. And so it creates unsustainable situations. And I think that has been one of the big things that we have seen. We have seen not only people just physically and emotionally drained, but oftentimes it can be challenging understanding and navigating the fact that there are vaccines that have been available, understanding that there are large numbers of our populations who have chosen not to be vaccinated, others who perhaps have not had access to it. And it is very difficult to be able to manage and maintain the continued empathy that we want and should be having for each of our individual patients. We've also seen a big impact as a result of shortages, particularly in the nursing space. This has been multifactorial, but I think most recently, what we are seeing is that if you are a nurse or a physician, you are very often also a husband, wife, brother, son, and even if you're not specifically so sick that you can't go to work, you may now be in a position where you have to not go to work because you have to take care of somebody.
Sure.
So we have that continues to then further impact some of the declines we've seen in available workforce. So now you throw in additional surges in patients coming in who are very sick. It makes the workload of the people who remain much, much more challenging. And so all of this creates this snowball effect. And so I think that, again, the people who are fighting this on the front lines are real heroes. And I think that as we continue to think about developing technology and anything that's going to touch current workflows, we have to be sensitive to what is going on and not be adding unnecessary burdens, but really doing everything we can in our innovations to really offset and redirect some of the inputs whenever possible.
Yeah, and my hope, of course, the pandemic has been difficult, and we're hundreds of thousands of people have died in the United States. But my hope is that it can be a vector for change, because to your point, burnout was around before the pandemic. But hoping to see people continue to make this a priority for clinical staff who have had quite a challenge over the past few years. So I agree with you. Let's see, our next trend is the need to invest in the patient experience. So, again, with digital management, I feel like you touched on this a little bit. As somebody who recently switched primary care providers because of a bad experience with my old doctor, I understand how this goes. So tell us a little bit about this one.
Yeah, no, absolutely. And I think, another element that's very real for a lot of people, especially given, in the last 6 months, the number of people changing jobs also creates oftentimes entry into a new system of care, oftentimes, right, dictated by the insurance companies. So right, I think that we have come to understand, I think, in the US, that your healthcare is not just the individual interactions between a patient and their caregiver, whether that be a physician, nurse practitioner, or anybody else that's a member of the care team. We have to understand that it really takes a team to take care of individuals, at least I think to take care of them optimally. And as people grow older, as people acquire more and more chronic diseases, conditions, it becomes that much more important that everybody understand the roles everyone is playing, and that there be kind of clean communication across all of the different participating parties. And I think that one of the things that is an important kind of common thread, whether it be people examining workflows, people designing software, is to really focus on the patient experience. And I think, the most successful, the most innovative health systems, companies, organizations have really taken this to heart and have really followed a patient journey from the moment it occurs to them that they may need something, all the way through surgery, a procedure, a clinic visit, or whatever kind of the end of their journey may be. And so I think that as more and more emphasis is placed on taking care of patients at a distance, so embracing what technology offers, embracing the social experiment that the pandemic was, forcing a lot of us into remote situations, we have learned a lot from that. And I think that it really is helping to accelerate this concept of healthcare 2.0, where it's just going to be called healthcare, right? It's just going to be another way for a patient to get the services and the care they need, and for a member of the care team to deliver it. And so I think that we have the technology that's going to enable this remote capability. I think part of what we will be seeing next is the intelligent application of analytics and potentially AI that not only can siphon through data and triage certain bits of information, or bring important things to people who can take action, or that can even automate the corrective action. And then ultimately, the ability to really personalize care not just to a population of patients, but to each individual patient. I see a lot of that coming forward, and that we are now experiencing and have taken huge strides in the foundation upon which all of these capabilities are going to be built.
Yeah, and I know at PerfectServe, we have seen a lot of this firsthand with the way we've invested our time and resources in developing products, especially since the beginning of the pandemic. So we've focused a lot more on patient and family communication, that kind of thing. So I think it's probably fair to say that a lot of healthcare organizations are seeing the same thing. So for our last trend or theme for 2022, got the need for asynchronous healthcare delivery. So tell us a little bit more about that.
No, absolutely. So if you think about to date, when we think of being taken care of by a care provider, whether it is a physician that we're seeing on a routine visit, a nurse taking care of us while we're in the hospital, or a team of chronic disease care nurses who are reaching out to us at home. When we think about the vast majority of those experiences are live, right? They happen either face-to-face or, by phone, or we are communicating like this via video. But I think what a lot of technology is allowing us to do now is to gather a lot of the information ahead of time and allowing everything to be collected and then placed in a queue, so to speak, for a human to be able to review. So if you imagine the intake process that you go through when you go to a physician, to an ambulatory clinic, and then you are filling out forms, and you are then meeting with somebody, and they're asking you questions and you're answering them. And then you have a physical exam, as well as the conversation thereafter. All of that can be broken down into recorded elements that can be packaged that someone can review at a time other than when it's being collected. And so what this can do is allow access to healthcare to a lot of individuals who may not, whose availability may not align with the available provider, at that moment in time. It also allows for the application of AI and other rules engines to evaluate what has been collected and potentially triage or flag things that need to be, that deserve more immediate attention than others. So the ability to help with the prioritization process. And so this is an example of how technology can allow a single human to actually touch many more people. And so I think that this is very, very exciting. I think it offers a new potential convenience for a lot of individuals who are comfortable with this way of kind of revealing, to the healthcare provider what's wrong with them, what they need, feeling confident that everything has been packaged correctly, and then receiving the recommendations in an asynchronous fashion. So I think that this is very exciting. We're seeing more and more of this, and I think it's going to continue to take off.
And I saw a study recently of, it was basically talking about why adults in the United States don't seek care. And honestly, one of the top reasons was more or less that it can be inconvenient. So as you talk about accessing care or seeking care kind of on your own schedule in a way that suits your lifestyle the most, this kind of thing strikes me as a vector that can be used to get people to seek care because it's more convenient than it used to be.
Oh, absolutely. And I think, I've done work in the past that, that really highlighted the fact that one of the other things that is sometimes harder in a face-to-face setting can be the revealing things that are potentially socially embarrassing. That it can be easier for people to put that down on a piece of paper, where the not having a direct relationship with the person who is evaluating and seeing it is actually, somewhat comforting, or at least less distressing than, than a face-to-face situation. And I think that we all have now started to realize, especially with Zoom, and there are times where we're just prefer to have a phone call because I don't want you to see me right now, or I'm perfectly happy sharing information in a written format, and you can get back to me within X amount of time. So I think that the ability to have a lot of this stuff translate and find its appropriate role in medicine is an exciting advance.
Yeah, and again, with PerfectServe, many of our customers deal with these things and are looking for solutions that can support these kind of changes. So it's always exciting to me that I get to come to work every day and hear about advances in this and other areas. So I'm sure we could talk for hours more about this, but this has been, I think, excellent content, some real great insights that I'm sure a lot of other people are thinking about as we kick off the new year. So I just want to let everyone know if you're watching and want to remember or reference some of these trends and themes that we've discussed, there's actually going to be a link down below so you can click and download a shareable one-pager with a recap. And you can also visit perfectserve.com and follow us on LinkedIn, Twitter, and Facebook if you want to stay on top of the latest news and developments in our world. So Rodrigo, thanks again for your excellent insight. And to everybody watching, take care and stay safe.
Thanks very much for the opportunity, Matt.